Morning, everybody.
Morning.
Welcome, welcome.
Hello.
Chris, hey, Isabel, hi, Serena. Lori, hello. Hi, Walker. Glad you're here.
Hello.
All right, and Claudia, I want to make sure I can hear you. Can you try saying something out loud? Sorry, no camera on this computer from Lori. Okay, no problem. Right. Having audio issues. Okay, Claudia, why don't you work on that while we kind of kick things off here. So Claudia is going to be our speaker today. Let's hope. You also have the opportunity to call in, Claudia, if that helps. Let me admit some more folks. Well, hi, Dorette.
Hey, this is Claudia. I think I just got my audio fixed.
Oh, hooray. All right. Thank you. I'm glad you're here. Welcome, everybody. Okay, so everybody's kind of getting on board and settled here. I'm going to share my screen and get us going. Thank you all for continuing to come. I think we actually have a couple of new people here, and I imagine we're going to have a few more joining us today. So this is our 5th meeting. Thank you for being here. I want to actually just start like we normally do with just reminding us what our purpose is, and then giving a chance for folks that haven't been here before to introduce themselves. So our purpose with these meetings has been to connect national health and climate data experts, and then invite you as a group to exchange knowledge on priority tribal adaptation and resilience data needs, share tools, practices, ideas, and lessons learned from the field. And a lot of what we're doing is exploring opportunities to develop and scale up solutions to address tribal resilience data needs. And so that's what we've continued to do. I'm really pleased that we have been, as a group, actually plugging away at some of our goals. So the first couple of meetings we have kind of defined what we're doing together. And so we have our shared file where we have our charge, where we're describing what some of our objectives are. And I think we continue to plug away at it. And then we've had 3 tools that have been presented so far. We said we wanted to identify tools and see how well they're serving tribes, and try to figure out where there's opportunities for scaling up or improving these tools for tribal communities specifically. So, we presented our tool. We've had Xavier present their temperate tool. Last time we had University of Washington present their tribal climate tool. And so today we're really fortunate because we have Claudia Brown from CDC, the Climate and Health Program. And she's going to share a lot of different data sets, including one of my absolute favorites, National Environmental Public Health Tracking Network, that I use all the time. And I'm just excited if it's not in your toolbox, that you can help spread the word. But as always, these are two-way conversations. These are interactive meetings where we're solution oriented. So with that said, before we move on in the agenda, I do want to ask folks to introduce yourself in chat if you've been here before. And if you haven't been here before, I want to give you an opportunity to just say hi, your name, organization, and your location. And I know some of you that are new, and I'm going to say hello for you. Osamu, do you want to say hello?
Yeah, hi everybody. My name is Osamu. I use he, him pronouns, and I'm just coming on board as a tribal climate change program and policy specialist with the California Department of Public Health's Climate Change and Health Equity section, which is in the Office of Health Equity. And my job is going to be to provide technical assistance and support to tribes with climate change and health equity planning, which could include air quality and wildfire smoke and cultural burning and all sorts of different kind of health equity pathways. So please feel free to, if you'd like to make a connection, and I'll just drop my email in the chat.
Thank you. We're so glad you're here. And Lisa, would you like to introduce yourself?
Happy to. Hi, everybody. I'm Lisa, she, her pronouns, Associate Planner of Climate Equity and Resilience in the California Governor's Office of Planning and Research. I'm leading the development of the state's Vulnerable Communities platform. Very excited to be here, and I'm based in Oakland, California. Thanks.
Thanks, Lisa. Glad you're here. And Serena, do you want to say hi?
Hi, everyone. Good morning. My name is Serena Vega. I'm based in San Diego. I'm assisting Angie in Prosper Sustainably with some project management with the SoCal data development with tribes, but I actually have a lot of experience in air quality on the US-Mexico border. For those of you in San Diego, I used to work at Casa Comunidad. Yeah, and I bring a climate justice and environmental equity perspective to my work. Thanks.
Thanks, Serena. I think that's everybody that's new. And Shas, I don't know if you wanted to say anything as we kick off here. I know you just went dark on your video.
Yeah, I had one of those annoying staff people just randomly wander in and start talking to me. Is she still listening? Yeah, just hi everybody, Shasta Gone, Environmental Director and other stuff at the Paula Band of Mission Indians in San Diego. I'm sorry if if it looks like I'm not paying attention. It's probably because I'm not. I'm hosting the Tribal EPA Region 9 annual conference next week, and that is keeping my head spinning like Linda Blair in The Exorcist. So I'm just, if I make funny faces, it's not because of anything anybody has said today. It's just because of other stuff. So I'm just going to mute myself now, and I'm glad you're all here.
All right. Thanks, Shasta. Well, it's actually a good segue into member announcements. We do this every time. It's a little part of our standing agenda, just so we can share information amongst each other about what's going on. I have quite a few updates I can share, and let me start by saying, I'll just share from Tribal Climate Health's perspective. Yeah, we have a couple things going on. So Shasta's conference, the EPA Region 9 conference, is a virtual conference. We're going to be presenting on the topic of accessing tribal climate and health resilience data. And so we've done that a few times. It just continues to help us build capacity amongst California tribes to access what's available in terms of meaningful climate and health resilience data. We are also planning, we just began planning for what we think will be an in-person summit for the summer of 2022 related to that topic on tribal climate and health vulnerability. And that's expected to take place at Paula, but all those details will be coming along, but that will probably be for a national audience of tribes. All right, so I want to make sure I give space for anybody else to provide any updates. And so, our pocket, the relevant updates would be things that are tribal focused, that are in the realm of climate change and health resilience data. And I actually might pick on some.
Hey, this is Torette. I just wanted to say I gave a big shout out yesterday for tribes and small rural frontier counties and indigenous peoples who are unrecognized and impacted by wildfire on the national, is it the Institute or Association of Science, Engineering and Medicine yesterday on a panel. So I just wanted to let you know that happened. And there were some really great tribal speakers also participating. There should be a recording coming out. It was a 2-day panel that's or event that's continuing today also. And
any good news on data sets?
I think one of the things I really promoted was that, and one of the other speakers on the panel I was on, who was from a funder, was that the need for microdata. And I thought that was important. And I just spoke to the fact that some big data sets really erase tribes and erase indigenous people because they focus on critical mass a lot. And, the other problem, in quotes, other, where a lot of tribal people are, because of the smaller populations, get erased through being put in the other box. Anyway, that's there was no data sets I heard of that were specifically oriented to tribal or indigenous people. And, you know, really, I was just trying to say, like, you have to get on the ground sometimes and really work with tribes to get the data locally, or to help them get the data locally for themselves, as you are doing. So,
Yeah, I've come across that issue of AI and populations getting lost in the data, and some of that I have found has to do with confidentiality or privacy, but those data gaps present themselves pretty often in my work.
yeah, it's confidentiality of health records, or because once it's a smaller group, it becomes easier to identify the individuals if people like just know by word of mouth who was impacted by a particular chronic disease or died of something and things like that.
It's usually a sample size problem.
Yeah.
Yeah, I feel like, okay, so in this conversation today, I think we're going to start the conversation going deeper into data gaps. So we're going to keep those kinds of things in mind. Thanks, Dorette.
Yeah.
So, you know, in California, there's so many of us from California here, but not everybody. We did get a $15 billion climate resilience package adopted really recently. I know it includes some support that's going to help California in looking at its vulnerable populations and supporting data, including a 5th climate change assessment, which will include, I think, at least a tribal chapter. I wonder if anybody wants to share anything more about that. Maybe it's too new. I do want to ask Lori, because I know you just came out with some reports on listening sessions. Do you want to mention, you know, kind of a high level, anything that came out of those reports and the input that you received from some California tribes, providing their perspectives on their climate impacts? So I think you're using it for your climate change indicators work.
Yeah, it's part of going to be included in the climate change indicators report, plus they are standalone reports on their own. They're from the Eastern Sierra, Southern California, and then Lake Mendocino and Sonoma area tribes. And yes, we know we're missing big chunks of California, but that's what we've done so far. And they're interesting. As everybody knows, all the tribes are different and the impacts that people are seeing are different. Something that I learned recently, and I'd be really curious to know from other tribes, is in Pomo, there's no word for drought. There are words for floods, heavy rain, light rain, early rain, late rain, but there's no word for drought. And so I'm really curious to find out if that is something that is seen in other tribal languages, or if some tribes have words for drought and some don't. Thanks.
Thanks, Lori. Yeah, that's interesting. Anyone else with any updates from around the country?
Hey everyone, this is Chaz. Today we have at noon, the BIA is having a tribal listening session on tribal youth resilience and climate change. I'm not sure if people are aware of that. They're going to also be hosting 3 additional listening sessions in the next few weeks, I think over the next 4 weeks. And the intention is to hear directly from the tribes on their needs in terms of tribal climate resilience.
Do you have a link?
I will gather one after I finish chatting here. I'll put one into the chat box.
Perfect.
And then ITEP and AT&I and the Blue Lake Rancheria are hosting a tribal hazard mitigation planning workshop series next week. It's 4 days from 1:30 to 3:30, virtual. And National Adaptation Forum is coming up. And I think I have others, but, and then the National Climate Assessment, the 5th National Climate Assessment I'm on that author team, but we are just getting started with the zero order draft. And after we get the zero order draft submitted on Friday, the public will be able to weigh in on that extremely rough outline.
Mhm.
So that's the entire update that I have. Thank you.
Thank you. Yes, that reminds us, Tribal Climate Health Project, we got selected for the National Adaptation Forum tribal sessions. So we're presenting there too. All right, on the federal scale too, I just want to mention two things. Beth Gibbons, who is the executive director of ASAP and a member of ours, she just announced that she's heading to Detroit this week to meet with, what did she say? She said the NOAA administrator, chairwoman of Council on Environmental Quality, and Congress members on racial justice and climate adaptation. And so she's really good about delivering messages with, related to climate services and data. So it'll be interesting. Hopefully she comes back and shares what she's learned there. The other big news on the federal scale, in my mind at least, is all the releases of the federal adaptation plans, and I haven't scanned through them. There's a lot of them, but I imagine there's probably a lot in there for tribes. I'd be curious to see if there's anything in there that tries to sort of provides climate services through federal agencies, including data. I don't know if anybody has any input or insights on that. All right. Well, cool. Last call for member updates, and we'll move to the next piece. Okay. So we do have our shared doc, and Shasta, I don't know if you're available to drop the link in because I'm sharing my screen. It's a little tougher, but we do have our shared doc, and two things I wanted to do here. Maybe I will just go ahead and unshare this portion of the screen. So this is our shared document where we keep everything that we're doing together. We have our charge, we have our member directory, we have I included our presenter schedule. The thing we wanted to focus on this last time we talked was agencies and allies, and this topic has kept coming up at these meetings where we said, it sounded like folks were concerned that what we're doing here might be duplicative. I've come across a lot of allies that are doing adjacent work, and a lot of them represent organizations that come to these meetings. I haven't found an effort that seems totally duplicative, and what I mean by duplicative would be let's see, so basically, any organizations that are already exploring and advancing collaborative solutions that increase access to meaningful climate and health resilience data for U.S. tribes. So this sort of solution orientation where we're bringing together all the experts and trying to advance or scale up good solutions. So if you do know, let's get them on the table, because we definitely don't want to continue to march in somebody else's turf. We don't feel turfy about it. But if you do know something that they've already worked this out, there's already some other working group, let us know. Any input on that? The other thing I want, and while, if you do have it, just chime in. And I want to invite anybody who's not already on the member directory who's here to go ahead and please include yourself on this member directory tab. So let me go ahead and put the shared file here in the chat. And if you can, just go ahead and click on that, go to the member directory tab and just fill it in, just so, put whatever information you're comfortable sharing, including your role and whether or not you're at some point willing to present at one of these meetings, or that you're willing to be contacted by tribes that are looking for support in this area. Okay. All right, so Tom, I don't know, I think you were one that maybe thought there might be some duplicative efforts. Do you have any other input here?
No, I don't. No.
Okay. I think that means we have a clear path here. Okay, so great. that means we can move right into our featured solution for this month. And I want to thank Claudia Brown for agreeing to present with us. She is with the CDC's Climate and Health Program. And there's been some news about your program recently, and it sounds like just a lot going on. So I want to hand it over to you. And I do have your slides, but if you want me to let you share your screen, let me know.
Yeah, I'll just share my screen.
Okay.
Okay, so it says maybe I need to be elevated.
Yeah, let me go ahead and do that.
Yeah,
Okay.
so I'm gonna demo some of our tools. So I'll present on just a few slides and then move into demo. Here we go. Okay, how's that look?
Yep, great.
Okay, I'll hide that guy somewhere. So thanks for having me. I'm happy to be part of this group and hear about the work that everyone's doing, as well as today, hopefully get some input on some of the work we're doing. And we're always open to feedback, suggestions, ideas, as we're always updating our products and strategizing ways to make them more effective. And as we're talking about data gaps, obviously I'm coming from the federal perspective and the national level kind of data sets, which have lots of gaps, though we are trying to take these large data sets and downscale them to make them more useful at the local level. And we'll talk about some of the gaps and issues that we've had doing that over the years, and welcoming suggestions on that. So just briefly, a little bit of background on our program. We at the CDC, the Climate and Health Program has been established since 2009. We are a $10 million budget currently, and with that funding, a lot of it goes out the door. And our aim is to be a national leader in empowering communities to protect human health from a changing climate. And we have these 3 strategies for doing that, which is building the evidence base, expanding capacity, and telling the story. And we feel that some of these tools that I'll talk about today is really trying to get at that expanding capacity element, as well as telling the story, as it's trying to make data more accessible. So this is just a map to give a sense of who we fund. We have our BRACE grant, which funds states and cities to implement the BRACE framework. And then we also have cooperative agreements with various organizations to fund these kind of mini grants. And we've been able to fund through the National Indian Health Board, some tribes, and then also some territories through NACCHO. And so what we kind of the framework that we always go back to as we're talking about climate change adaptation is the BRACE framework. It's building resilience against climate effects. And it is a 5-step process, though an iterative process. So once you end, you are not finished and adapted, but you go back to the beginning and you're always refining. But the idea is that this is adaptable, but a general framework for the process of moving towards climate adaptation. And so the first step being assessing the impacts and vulnerabilities, and then projecting that disease burden. So what's it going to look like in the future? Assessing the public health intervention options, as well as capacity to implement those. And then developing and implementing an adaptation plan and evaluating the impact of that to then refine and adjust some of your work to make it even better. So just as a reference for anyone that's more interested in that, because I'm not going to be spending time on BRACE necessarily, but we do have a technical report series that outlines information for each of these steps, and that can be found on our website. And just to make the point that one size does not fit all in adapting to climate change. And so it's very much, we view this as important to always think about ways to adapt. You know, we have this framework that outlines what the ideal maybe situation is, but it can always be adapted for low resource environments, maybe lack of political support or various circumstances that a community might be facing. And we have worked with NATO to develop kind of an adaptive framework for BRACE. So I'll be talking about specifically today our two tools, the Environmental Public Health Tracking Network's Data Explorer, which we work closely with. That's a separate program at CDC, though we work very closely together on that. And also the Heat and Health Tracker, which is a new data product that we're hoping to expand and move into other climate hazards. But there are lots of other resources that we have on our webpage, from a social media toolkit, guidance and trainings, short videos that can be useful for communicating this to a general audience, and that can all be found on our website. So from here, I'm going to move into a demo of the Environmental Public Health Tracking's Data Explorer. So I'll share these screens or these slides after, so you'll have access to all of these different links. But the Environmental Public Health Tracking Data Explorer is a place where we have aggregated various data sets that are relevant to environmental health, both on the exposure side, also some vulnerability and demographic data sets, and then some health impact data sets. And so the way it works is when you go to this panel, and feel free to shout out if there's any questions or anything. I can't see the chat because I'm on a one screen right now. But when you get to this panel, you have your content area, so you can choose which topic you're looking into. We have various, this is not specific to climate change, though we have climate specific data in here. So for example, I'll go to heat and heat related illness. And then based on which content you pick, you have various indicators that are here. So whether you want to look at hospitalizations, mortality, maybe even temperature and heat projections. So I, from here, will go into the historical temperature and heat index. This is actually a new indicator that we've put up recently. And so you can choose your measure from here. So with that data set, maybe choose number of extreme heat days. And you can choose your geography. So I'll just do national. So based on the data, we sometimes have census tract level, sometimes have county level. I'll go to census tract. I hear there's a lot of people from California. Take a look at California. And these are just various, depending on the data you choose, you can choose, you know, things like whether you want to look at a relative threshold or a absolute threshold. I'll look at a relative threshold, just keep it where it is. And then this will put the, you know, pull the data and put it into a national map. You can also download the data for any of this information. And then you can also explore, you know, where this data is coming from, how it was calculated, those types of things. My internet's running a little slow.
And Claudia, for geography type, what options do we have? Is there something smaller than census tract, or is that the smallest?
Census tract is the smallest for this platform. Now we have, with wildfire smoke, been able to put that on top of as a layer that's more of like an image. And a pixel rather than census tract level, but we tend to be functioning on the census tract, which is, smaller than the county, but, and I'm kind of curious, how relevant that is. My understanding is we do not have the option for, I think the question was tribal selection. And my understanding is that that doesn't exist at this time, but something that I'm definitely going to punt back to the IT team and see, what the options are for that.
What's the data source used for wildfire smoke?
That's a good question. I'm not exactly sure. I can explore that and get back to you though.
Yeah, that's okay. I can also just look it up. Thanks.
Yeah. We do, our wildfire person should be on this call, but is not, unfortunately. I'll mention too, so you can do this second view over here on the right, and you can again go through and choose a different data set. And that can be useful when looking at and wanting to compare, for example, like an exposure data set to the health outcome data set, or a vulnerability data set to the exposure data set. And so you get that kind of side-by-side view of the data. Any questions about this? And I believe they now have a functionality where you can pull a map, like their platform, and put it into another web page. So if anyone's interested in that, I can connect you with the IT team. But that I know has been useful for some that want to put it maybe on their climate change pages.
Does that mean like a function? Because you can already download the image.
Mm-hmm.
And you also, what I really love is that you have the ability to have, with that share button, you can connect, can hyperlink to the actual URL for this specific indicators with the right parameters. Thank you for doing that.
But this is actually having the platform and the functionality on your web page.
Got it. Interesting. Okay.
Yeah, that's a new thing rolled out in the last year. They're always updating things. So I should be getting those updates, or maybe even bring someone on from their team over here to be part of these conversations. So I'll move, and we can talk more about this, but I'll move into kind of where we're going with this work beyond the Data Explorer. So we developed this last year, or actually it was last heat season, it was launched, and we've updated it this coming into this past heat season, but the heat and health tracker. And so the idea of this is that it's it's processing the data on the environmental public health tracking networks, Data Explorer, and going ahead and processing the data for a more general audience. So, you don't need to go in, select your indicators, select your thresholds, but we're, populating the information into this data dashboard with the intention that this is for maybe media, maybe policymakers, just a more general audience. And so this was our first launch of anything like this. The tracking program worked with the climate health program to develop this. And we have found that we've gotten a lot of feedback that has been really great. So we're thinking about moving this into other hazards, but I'll show you briefly what this looks like. I do see a question from Osamu. Do you want to unmute yourself?
I'll just hold it until you're done talking because I don't want to interrupt your flow. Yeah.
So on this page, so this is our landing page, and we have these various tabs. This is interactive, so we can look at historical heat, current heat, heat-related illness, monthly forecast, and projected heat. So this tab that we're on right now, heat-related illness, this is actually weekly heat ED visits associated with heat-related illness per 100,000 ED visits, so it's a rate. And you can scroll across weeks. And that chloropleth map behind it is that week's average temperature, maximum temperature. And so this is unique. We're using National Syndromic Surveillance Program health data, and that's not easily accessible at a more downscaled view than these HHS regions, but we are working with them. This was our first kind of collaboration with them, and we're really hoping to get this down to at least the state level and maybe even further if we can. So that's coming in weekly, always being updated. We have our current heat, which is showing, is being pulled from the National Weather Service, is showing heat for today, maximum temperatures, also forecasted for 2 days ahead, and minimum temperatures. And then we have historical heat. We have a monthly forecast. This is actually a new data set developed with NOAA and this isn't looking very interesting right now because we're not in the heat season, but it's showing the future months outlook for what number of days are expected above a dangerous level of heat, which is being defined as the 95th percentile of historical heat. And this is at a census tract level as well.
For your heat health data, in the past, you've had a seasonality in the definition of like ED and hospitalization and mortality. But I'm with San Diego County of San Diego, and we've had heat waves as early as March and as late as November. Do you still use that same seasonality for the heat health? Or
I'm not exactly sure what that definition was.
Used to be May through September, and those were the date, the time period, and it was a national thing, right? So we in-house also look, using the same definition, but let's look at any mention throughout the year. Now, we aren't seeing a huge amount, but we definitely have a heat season that can be extended beyond that May through September, right?
Yeah, so my understanding is the data being pulled from National Syndromic Surveillance Program, that's being pulled all year round, and it's any kind of anything that was coded as it was a heat-related illness. So my understanding is it shouldn't have that seasonality component to it.
I'll see if I can noodle deeper. Yeah, this was a few years ago when we got that. I go and check, but this one is a little different. So I was wondering if it had something a little different. So, but I'll noodle into it. Thanks.
And just briefly, I'll just say, we have this projected heat data, which has been giving us some issues lately. There we go. And we are, there it is. Hoping to update that soon with some updated projections. And just briefly, I'll say we have some general stats down here about ED visits due to heat on average, and heat-related deaths that occur on average each year, as well as hospitalizations. And this is based on some recently published MMWRs from CDC on heat and health. And everything is actually traced back on that about the data link. And so you can dig into it further there. what's kind of unique about this page is when you enter your zip or your county, you will actually be taken to a downscaled version of this data. And so I'll throw in a county. I'll just do Maricopa County, Arizona. They always have an interesting page because it's so hot. But here you'll see, and you can do this for any county, but it gives you kind of a general background and description of heat in the area, number of days above 90 that they've experienced. We've done this kind of like 90-degree threshold. For now, we've talked about changing that for each county to be specific to the county, maybe based on a percentage like 95 percentile. And then you see today's temperature. As you scroll down, you'll see this is the heat wave forecast data that I was mentioning that we've worked recently with NOAA, and it's giving kind of a probability of in the next month what the heat wave forecast looks like. And then here we have the blue is a historical daily maximum temperature for the county. And the red line is the current year's heat daily maximum temperature throughout the year. So you can compare how did this current season compare to the historical average. And then finally down here you have a data explorer around heat vulnerability. And so you actually can adjust your layers. You have vulnerability layers here with some demographic data, community characteristics, exposure data, and then you can select points of interest such as daycare centers, parks, nursing homes, public schools, fire stations, things like that. And you can even, as you scroll across, it gives you the count on the chloropleth layer. And then if you select the point location, which I'm kind of having a hard time doing, usually you can, you're supposed to get that information, but it seems a little wonky right now. And so finally, I'll just mention down here, we have population characteristics, and this is again specific to the county. So you can see, for example, percent of the population without health insurance, which is 12.6%. And you'll see in the small text below that the national median is 18.2%. So you can kind of compare in this county, how did the population characteristics line up to the national median? And then we have a age breakdown here. So that's the heat and health tracker. We are looking to expand this with new data and functionality. And so are welcome to the feedback and questions you have about it. And we're also looking at doing this for other climate hazards. So possibly flooding as an example. And one functionality that this has that the Data Explorer doesn't have is we've been able to pull in information more easily that's not at the census tract level, maybe even, like this, the National Weather Service data, things that are not as easily compatible with the Data Explorer. We have more functionality with this data platform. So we're hoping to utilize this in other ways as well. So I'll stop there. I'm pretty sure I definitely went over my 15 minutes, but welcoming any questions if we have time for them, Angie.
Yeah, we totally do. So this portion of the conversation is Q&A, but also discussion. So if during listening to any of this, some ideas or challenges or solutions, opportunities came to you, this is a place to talk about those too. There are some questions in the chat. So Lisa.
Wait, I want to go first.
Oh, go ahead, Shasta. Okay, go.
I'm going to take host privileges before I get distracted by something. I had a question about the heat indicators, given that someplace like Maricopa County, what is considered, excessive heat, or actually not excessive, is going to be different than what's considered excessive, say in Portland, Oregon, as we saw with the Pacific Northwest heat waves, where 85 degrees can be dangerous to somebody who's not accustomed to that, whereas 85 in Phoenix is like, wow, man, it's freezing. Where's my sweater? Like Isabel with her sweater and her hood. But so I guess my question is that considered as part of this tracker? Are they customized to the areas?
Right. So at this time, we're using, for example, this kind of 90-day threshold, which, as in Maricopa County, they're having 164 days above 90 degrees this year so far. That's not a dangerous level of heat for them necessarily. So we've talked about doing some kind of percent threshold, like a 95% threshold, and having that specific for each county. I guess that's one of the challenge that we've been having is there are not standardized national level, heat thresholds that are considered dangerous. Whether an area is in a heat, warning or a dangerous heat day level, that varies from region to region. So I don't know if folks are familiar with Rish Vaidy and Nathan, but he's been very involved in this on our side, working with the National Weather Service to try to establish some kind of standard risk level for the country, and whether that's a 95%, but we need some health data to back that up, that is relevant. So definitely one of the challenges that we've been having. So at this time, just to roll it out, we started off with 90 degrees, knowing that there was a big limitation to that. And that that is a high temperature in areas where there's not air conditioning, but not as relevant in the South, for example.
Thank you. And then I'll just throw out one quick suggestion, which is that if we want to see this data customized more to tribal geographies, which is one of the was Walker's question, is can you select tribal areas? Is that's a project that I think needs to be done, especially for tribes with larger land bases. So that's just a suggestion. Please move on to the questions in the chat.
I had some just to comment about the weather, is that Alex Tardy in our local National Weather Service that serves four counties has done a lot of work over the last 5-10 years on looking at what would be good, appropriate. When do you call it a heat wave versus not, from a what's normal for the area by climate zone, because we actually have 5, although we usually only consider 4 of them. So they're really, really active. And there's also been some work out of UCSD Scripps on the many ways one can define a heat wave, modeling wise, and then looking at that impact on human health. So yeah, there's some really interesting stuff coming out of San Diego in terms of how to address it from like the weather point, and then the heat. Well, there's a point, I mean, Shasta's point is well taken, that early in the season, 85 degrees can be, in Michigan is exhausting in February. You can have heat health. That's certainly been shown worldwide that, when you're not adapted, that heat wave is the worst for you. But then by, August, September, if you're in our deserts, if it's not 120, yeah, they're rushing for their sweaters and looking around. Why is it, it drops to 90 at night, and that's blissful relief. So when we are looking at the area that we see the heat illness, we can't really tie it necessarily to where the person was exposed, but you can look at their residence and you get some information, because there's a point beyond which the body can't tolerate it. So, the rubber hits the road when you hit the ED or the hospitalization, even though, that's the tip of the iceberg.
Yeah, and something we've talked about wanting to integrate too is the minimum temperatures, which are relevant, those nighttime temperatures.
Nighttime, yeah. The cooling is super important. Yes. Yeah, that ends up being discussed a lot on our heat when we have extreme heat, our heat plan activates and there's a heat wave, there's always a lot of, desire to look at how's it's going to cool down enough, and our Alex will address that as much as he can and say, yeah. And so you look at what other mitigation might need to be done. But yeah, that's always a concern for us too.
I want to get to some of the questions that are on the chat. So Lisa from OPR is asking about current projected heat data on the tracker tool is only at RCP 4.5. Is that correct? Are you considering multiple futures?
Yes, we are working to update that for sure.
Okay.
Both on the environmental public health tracking data explorer too. That was the first step that because it feeds into this, but yes.
Asama, do you want to relay your question verbally? You might as well.
Yeah, sure. And I don't know, Claudia, if you're the right person to direct this at, but I'm just kind of curious. It sounds like with this, there's a new kind of Justice 40 designation that the White House is using and FEMA is also using now to actually allocate money based on CDC's social vulnerability index. And that actually doesn't have these kinds of hazard variables like what you're showing us with the tracking tools. And so I'm just wondering if there's any movement towards actually adding this kind of hazards and other even like health data into these prioritization methods for who is actually getting money.
Yeah, so it's actually interesting that you asked that. We in our program just recently were awarded some funding to do some climate hazard specific vulnerability indexes. So trying to get at that, tailoring the social vulnerability index, which is very general, to climate specific hazards. So that would be incorporating the exposure, but as well as adaptive capacity, which isn't in the social vulnerability index, and there's not great established indicators on that, but something interesting to think about. We do use the social vulnerability index down here. We have that as one of our demographic layers, but definitely something that we acknowledge is generalized.
Thank you. Walker, do you want to say your question out loud too?
Yeah, sure. Thank you for the presentation and the data tool. I'm wondering, I think it was at the top of this page or the top of one of the pages, just basically like a paragraph. Yeah, right. So here's what extreme heat can do, so on and so forth. I'm wondering if there are, background materials that relate to, which vulnerable populations are disproportionately impacted by which indicators. And I know it's not as straightforward as that. An example might be references to the literature, and this is why we think this is an important indicator, because it disproportionately impacts this group in particular. I'm trying to think of amongst the trove of great data tools that are available here and elsewhere. How do health scientists and others start to really dig into the ones that, for example, here amongst this forum, disproportionately impact tribes, and how to see how that data is represented, and then work further with it. But the first step really is to look at a great database like this and start to filter down so it's not too overwhelming. So I'm wondering if CDC has, just as I said in this first paragraph, or if there are additional background materials related to which people are disproportionately impacted by which indicators or hazards. Thanks.
Yeah, that's a great question. And, I'm sure there's more work that needs to be done on that. I'm taking you to the About the Data page, which I haven't shown, but we do have each of these indicators that are being used, a description of where more information can be found about it. And then we have reference to, I thought we did, our MMWRs I mentioned earlier. I will also link them in the chat, but I know they were looking at different demographics and how there may be, the disproportionate effect of heat on across demographics. But to your point, there's probably various reasons why that there's probably data gaps, why that question hasn't been answered fully. But some.
Uh-oh, I think Claudia might have froze. Are you there?
Yeah, can you hear me?
Oh yeah, you're good now. Okay.
Sorry.
Um,
Did that come across at all?
yes, yeah. Not the very last piece, but Dorette has a chat here. The California Heat Assessment Tool developed methodology for heat health events and utilizes NWS averages at threshold at local geography. Nick Steinberg developed this. So sounds like California might have a model to look at. Walker comes from Cal EPA, where he's doing the Cal Enviro screen, which we should totally have presented here sometime. And so, I have 1.2 from my perspective. I'm always looking at how can I need to put this information into a report for a community, a tribal community, that it clearly expresses the bad thing we're trying to avoid. So that's as basic as I can make it, but I need to have it substantiated. And oftentimes that means drilling down into impacts, and where I often I'm so in love with all the CDC tools, and then I stopped at the point where I wish there were projections for health impacts, and there just aren't, and almost anywhere in the health world. I wonder where you're headed with that. And then along with that question, so having the projections and having them described and presented in a way where it's sort of already pre-calculated, interpreted, and described in a way where somebody could take it easily and put it in a report.
So your first question about projecting the health burden, usually, and others like Dorette can speak to this, but that's part of the BRACE framework and seen as something to do more locally, just because there's data and information at the local level that we don't have at the national level. But to your point, definitely something to think about doing and providing as a resource as the federal entity. So at this time, can't say that that's something that we're currently working on our plates, but I'm taking notes and sending, keeping a track of this. So your other question though, Angie, can you reiterate that?
Well, there's some tools like CalAdapt sometimes does a really good job. they sort of make some default assumptions. You can change them if you want, but then a data layer pops out and it almost describes it for you. So it's like, all right, so it gives you an average of historical trends, baseline, and projections, and it writes it in a way where it would be pretty easy to take that and drop it into a report where it's already been the sense of it. Somebody's already made sense of it. There's no additional assumptions that have to be made about why we care.
So asking about more of those resources.
Yeah, and maybe what I'll do is I'll try to find a really good example, and it would just sort of like be taking this and taking it the next layer down to make it as community ready, which is what I keep saying is possible. So why don't I find a good example of another tool that's doing it really well and send it your way.
Yeah, that would be really valuable. I mean, definitely, we were hoping that this can do the processing and the all of the work that that scientists do that work with these large data sets, and go ahead and do the work for you and give it to you, to make that easy. And to your point, not ask so much about why do I care? Like, obviously that's important. So definitely the intention of this, and would be something that we want to work on and make even more something that can be easily pulled and readily available for use.
I grabbed the screen back because we have to go, and I want to say thank you to to everybody for being here. Thank you so much to Claudia. This is recorded. I will be posting it and following up over email. We do have a next meeting on November 10th, and we don't have somebody booked for it. I might get somebody, but in the absence of that, I might just want to have a really robust conversations around data gaps and what we've talked about so far to this point, and just getting our thoughts down. And then we do have NOAA coming up, as well as the County of San Diego. So thanks, guys. And with that, I would say thanks again. We'll let you go on your way. Appreciate it, everybody.